Hi, I'm Hao Luo. I'm an assistant professor from the University of Hong Kong. It's my great pleasure today, on behalf of all the co-authors here, to present our recently published study on rates of antipsychotic drug prescribing among people living with dementia during the COVID-19 pandemic. First, a quick disclosure. This work was supported by the Research Grant Council of Hong Kong under the Collaborative Research Fund Scheme. And this particular study focusing on dementia is actually part of a larger scale study we call CHEVALO. It looks at the trends of 8 classes of antipsychotic drugs in 10 mental health cohorts. The CHEVALO package is available on the GitHub page. And so we expect more articles coming out from the CHEVALO, and the paper I'm talking about today is only one of them. So antipsychotic drugs are often prescribed to people living with dementia for the treatment of behavior and psychological symptoms. However, existing evidence suggests that they actually offer modest effectiveness and are associated with increased risk of adverse outcomes. So clinical guidelines recommend antipsychotic drugs should only be used as a last resort. The pandemic has disrupted daily routines and support of people living with dementia. So it has been suspected that dementia patients may have aggravated behavior and psychological symptoms during the pandemic. And as a consequence, we also suspect that antipsychotic drug use may have increased in response to the worsening of symptoms associated with the restrictions. When we're doing the literature review, we found 2 major studies investigating this hypothesis. One is the UK study. They used an NHS data and find that during the early phase of pandemic, from March to May, there is evidence of increase by 4.4% to 7%. And then there's another US study. They used the TriNet-X, which the data is predominantly US, and found the annual prescribing rate increased from 14.7% to 6.4%. So these 2 studies are limited by short observational period, both before and after the introduction of health and containment policy. The contemporary prescribing trends globally remain unclear. So our objective is very straightforward, which is to examine the rates of antipsychotic drug prescribing among people living with dementia before and during the pandemic, using multiple databases and also including a longer observational period. So the study period is set between 2016 to the latest available date for each database in 2021. We included people aged 65 years or older and also has a diagnosis of dementia. And then we calculated the monthly and yearly incidence of dementia diagnosis and also the prevalence of people with dementia being prescribed antipsychotic drugs. And we also conducted interrupted time series analysis to more formally test the changes, if any. Here we included 8 databases, 4 European databases for IQVIA, and we also have 2 hospital-based data from South Korea and 2 claim data from the US. So here is the result. So if you look at the incidence of dementia diagnosis, we actually observed rapid decreases in the incidence of dementia in the early phase of the pandemic in basically all databases except for Germany here. And the most substantial decrease were observed in US MDCR and also UK IMRD and also Italy. So there's very big decrease. However, in most databases, the incidence gradually increased after the acute phase back to the pre-pandemic level. And here is the monthly prevalence of people with dementia prescribed antipsychotic drugs. And we find the rates increased markedly in all databases except for South Korea and US open claims. And especially if you look at the UK, the increase is very substantial from 5.85% in February all the way up to 14.5% in May. Although it went down, but actually the level is still higher than the pre-pandemic level until the end of the study period. And then we further carried out interrupted time series analysis. to test if there's any significant changes. And here we find significant changes in 4 databases. So first, if you look at Italian data and also US MDCR, we see very immediate increase right after the introduction of containment policy, but then it went back down. And then there are another common pattern that is in Germany, IQVIA, and also US open claims. The rate continuously increased during the whole phase of pandemic. So here is the finding. To conclude, we found substantial increases in prescribing rate at different periods during the pandemic compared with historical averages in the same months in 6 databases, actually representing all the countries included. And our findings call for effort to develop intervention strategies to ensure the quality of care for people living with dementia. And we also call for more detailed investigation of changes in dosage and duration of antipsychotic drug prescribing during the pandemic. And we also should look at the factors that contributed to it and also the consequence. So the article is now available at JAMA Psychiatry. I would like to take the opportunity to thank all the co-authors, and specifically want to thank these data partners, Xiaoyu and Tan from IQVIA, Stephen David from Jensen, and also Dongying from South Korea. And in particular, we also like to thank the psychiatry work groups, which provided us a lot of very good advice, especially in the early phase of the design of study. So here it ends my study, and if you have any questions, feel free to contact me or leave your question in the chat. Thank you.